Hey, Bravehearts. I'm Dr. Daryl Wolf. This is DocStar TV. And we're coming live to, well, people all around the world, actually. So good morning, good afternoon, and good evening. And I'm here with Michael. And just so you know, just as we start this, I just want to say it. Yeah, I've got my Tesla glasses on for a reason, because right now, just so you know this, I already told you that I'll be doing 2 to 3 shows every day up until probably Christmas, or if I'm traveling or something like that. And they're called Real People, Real Healing. So, Michael, we have never talked before except for, hey, my name is Michael. I've got a knee problem. I'm bone on bone. Can I get a consultation with you, and can you tell me what to do? Is that the truth?
That is the truth.
Okay, so just so you know, everyone, I'll be asking him questions now. And just like you, I'll be hearing the answers for the first time. I need everyone to understand that, because it's really important that you understand this, that I teach people all over the world how to be New World practitioners, which means they'll come to my Whole Life Coach course and they'll do emotional consultations, nutritional consultations, and build perfect days for everybody around the world. And that's after doing a 9-day course. So you can go, oh my God, they shouldn't be allowed to do that. But understand something. I will take anybody that hasn't succeeded with a functional medicine doctor or a naturopathic doctor, and it's not because I'm telling you they don't know what they're doing, and I will put that person with somebody who took my course once, not twice or 3 times, and they'll knock it out of the park, because they also learn how to do Wolf non-surgical. And understand something, you can believe it or not believe it, but not that we know of, we hadn't had anybody go to surgery that had bone on bone in their knee, their hip, their spine, or a shoulder problem that they had to have surgery, or anywhere else in the body that I know of in a long time. The reality is this, the human body's amazing. The reality is this, I carry a product called calcium ion therapy that'll carry all the calcium that's displaced out of the bones, back into the bones, and out of the joints, and out of the tendons, out of the ligaments, and out of the organs. I'm not making this up. This is actually a product that they told me that I could not put in my store and that you could just order it. You have to call in, and it's called calcium ion therapy, Merigen, Cardigen, depends on the problem. And you have to call in to actually order this product, because the FDA can't stop us from selling it, but they can definitely cause some hurdles for us and threaten us that they'll take our website down if we put it in our store that you can just buy it. The reality is that what you don't understand is what, no matter what joint it is in the body, okay, what growth it is in the body, whether it's a fibroid or a tumor, okay, a cyst, okay, it's all about inflammation. It's all about infection. It's all about scar tissue formation. And that's it. So you can believe it or not believe it. Okay, my friend Michael here doesn't realize, but his whole body's full of scar tissue. And that's what we call old age. Okay? How old are you, Michael?
70.
70 years old. So Michael, I just want to tell you this. You are 3 years older than me. Okay?
Okay.
All right. So I'm going to tell you something, Michael, that you can be as young as you want. You can feel as young as you want. And I'm not kidding. So if you want to be young again, you can have it. Just understand something. The secrets lie in the joints. And the joints become calcified and they get full of scar tissue. And we can reverse those 2 things. If I could get all the calcium out of the joints back into the bones, Michael, and I could turn the scar tissue, which does not have elasticity or proper circulation, and I could return the proper circulation and make you more elastic, instead of feeling like that if you do full extension or full flexion, you're going to tear out. Isn't that how you feel in that leg? That if you make a wrong move, you're going to tear out. If you extend it or flex it too much, you're going to tear out. Am I right or wrong?
You're correct.
So the reality is I call this all bullshit, and this is me, Dr. Wolf. I just swore, because it is. I don't know any other way to say it. It's all crap.
I've heard that word before.
It's all crap. I know, but people get offended when I say it, and I don't mean to be like that, but I want to put an exclamation mark on this. And, let me finish. I'm wearing these Teslas because they take the blue light from, I've got 3 phones here because I'm on 4 different platforms. Okay, and I will not have all that blue light poisoning because at the end of the day, my eyes will be burning, and I won't do that. So now that I'm doing 3 shows a day, 2 to 3 shows a day, I'm not going to be not wearing my glasses because I'm not going to dishonor, disrespect myself. So people will be coming on here that don't know I just say that, and they'll go, well, who does he think he is? A movie star? Yeah, well, there you go. Okay. This is my movie, and it's called Doc Star TV. And yes, so remember something. We're all actors. And guess what? You can decide today if you want it to be a drama, trauma, or you want it to be a horror story, or you want it to be a love story where you save yourself at every given moment because you've decided to be your own practitioner. You decided to be your own hero. You decided to be your own lover and fill up your own heart instead of tearing yourself apart. So here we go. Michael, you're 70 years old?
Yes, sir.
Are you retired?
Sort of.
So what do you like to do?
I like to play golf.
Okay, of course you do. Well, guess what? We can have him playing golf and we can have him doing more. Now, I'm just going to tell you, Michael probably is the average guy who looked after himself the best he could. Now, understand something. I need you to get this. Michael might have injured, which knee is it? Is it your left?
My right.
It's your right knee. So that means he's got a cecum block, everyone. So that means that if he looks up where his cecum is just above the hip, that his cecum has actually been backing up waste for years. And guess what? We know that if you absorb your own waste, that it's going to go down into the leg of that side. And the reality is, whether you believe this or not, Michael's been pooping in his pelvis like everybody else. Everybody thinks they've got great bowel movements. Everybody thinks they've got a really great diet when they should have a live it, not a diet. And the reality is, I'm gonna tell Michael what I would do if I was in his situation. That's all. I'm not going to tell him that. I'm not telling him what to do. I'm telling him what I would do if I was in a situation to turn it around. Okay. So, Michael, why don't you tell me what's going on and what were you told, and what are you feeling?
I feel, well, first of all, about a month and a half, 2 months ago, I started feeling some pain in my right knee.
Okay.
So
Is that the first time you had pain in your right knee, or did you remember ever
Yes.
injuring your knee, or no?
No.
Then guess what, everybody? If there wasn't an injury there before, Michael was pooping in his pelvis on the right side. So understand something. He's also going to have trouble in his right hip. And he already has some trouble in his right hip. And guess what? The other knee is going to be in trouble if we don't get this one fixed. And the reality is he could go and get knee surgery, and guess what? He won't probably have any more pain, but guess what he's going to have? A stiff knee. He says, oh, I have no more pain anymore, but I don't have the flexion and the extension like I used to have. Well, that's because knee surgery causes more scar tissue than anything else you can do, the surgery part. So you're going to have a lot more scar tissue there, but you may not have the pain. Go ahead, Michael.
So anyway, I had the pain start, and I just kept, walking on it and walking on it. Finally, I got an appointment with an orthopedic surgeon, and I went in, and he x-rayed both knees, went into his exam room, and he told me, he says, the right knee is bone on bone, and the left knee is not far behind.
Okay.
So I said to him, what do you suggest, Paul? Oh, there you are. So anyway, he said, and the left one's not far behind. He said, we can do injections or we can do total knee. And I said, well, I've had back issues in the past. I have 3 bulging discs, and that's another story down the road.
One second. Those bulging discs happen to be in around L3, L4, L5?
L4, L5, S1, yes.
Oh my gosh, what a lucky guess. I guess I'm just a lottery winner. Okay, so the reality is I knew that. You know why I knew it? Because he's pooping in his pelvis. If you were to go at where the transverse colon is with Michael, it has dropped. It used to be up here. It's down here. If you were to drill a hole right through from the front of his abdomen and go through, you would hit L4. Okay? And the reality is this. Michael doesn't have a bulging disc except for one reason. And that's this. Are you ready? So we have the pelvic bowl, right? Are you with me, everyone? Pelvic bowl. Now, Michael, think about this. When you go to the bathroom, how often do you sit down and it comes out easy? Or sometimes you have to kind of push or wait or struggle a little bit. Or let's answer that one, then I'll have another question for you.
A little bit of both.
Got it. And guess what? It's been happening all his life. Because if it wasn't happening, he wouldn't have a bulging disc in his back in L4, in L5. I'm telling you, I'll put money on it, guys. Anytime you want to do this or anybody want to go to bat with me and come on my show and challenge me, I'm ready for it. Okay. Just so you know, because that's how confident I am, because I've been doing this for over 40 years. Now, pelvic bowl, large intestine. When's the last time you had antibiotics, Michael?
Been a long time.
Oh yeah, but how many times have you had them in your life?
I took a Flexeril. That's just for pain. I took one of those the last 2 nights, but I haven't been taking that at all. I've just been taking anti-inflammatories and Tylenol for the pain.
Okay, but just know this. What they do, okay, is they cut off the gut-brain connection, which is actually your bacteria sending messages to your brain. So now we've cut that information off so that Mike can sleep, all right? But guess what? The infection, the inflammation, and the fire still goes on. So the more that he takes his Tylenol and these anti-pain pills, he's not getting the communication to his brain that he has inflammation in his knee still. So the pain comes down, but it doesn't. The fire's still raging in his knee. That's why people that take drugs for pain always go to surgery, because eventually when you have pain, it's your body, it's a GPS. Your body's saying, hey, listen, Michael, you're dehydrated. Michael, you need to go in and take the scar tissue apart to get the blood flow back in so you get that flexibility and your pain would be gone. Michael, we need to get the calcium out of the joint, okay? Because that's like rust in a hinge. So you're not going to be able to move very well. And the reality is Michael, where do you live in California? 1 second. I forgot to put my phone on airplane mode, so we're going to get these calls. So I'll try to jump on as quick as I can. My apologies, everyone. So anyways, so guess what, Michael? If I had you here right now, I'm in Florida. And if I worked on your knee for 30 minutes with doing Wolf non-surgical, I would love to do this. You want to fly in here to Florida? I'll do it for free. We'll go on here and I'll do it for 30 minutes. And you know what you're going to tell everyone? I've got no pain and I can walk normal. Now, does that mean it's completely healed? No. It means that you have to understand what I've done, is I've moved the calcification out of the tissues more, got the circulation up, and understand this. Michael, do you know what beef jerky is?
Yes.
What is it?
It's dried beef.
Oh, wait a minute. No, Michael. It's your knee. That's your knee. Okay, so do you have some beef jerky in your house right now?
No.
Well, because if you did, I'd ask you to go chew on a piece, because if we were to actually chew on your knee, that's what your knee is like right now, is a piece of beef jerky. And guess what? We can actually restore that knee back into a beautiful, vibrant piece of connective tissue that has no pain, has the flexion, the extension, and the strength it used to have. And you're not going to have that. You go for surgery and you can kiss that goodbye, because surgery causes more inflammation and scar tissue formation. You may say that you don't have pain, but guess what? You are not going to be flexible. You are going to have trouble out on the playing golf. You're going to have trouble. And you are. I'm telling you are. I've been at this long enough. So that's why people don't like to really challenge me, except come on here and just throw stuff at me that I don't even know where they're coming from, but whatever. The reality is that you have the same problem as everybody has, because no one has been taught how to actually look after themselves. Okay? Would you say that I look like the average 67-year-old guy?
maybe a little younger than the average 67 that I've seen.
Okay.
And I've seen a lot, so.
I'm telling you right now that you can turn back the hands of time. It's got nothing to do with genetics, okay? Just like disease, there are no genetic diseases. There's epigenetic ones. So we just got to change our thinking, okay?
Right.
All right, so here we go. Let's talk about how much water do you drink on a bad day?
That's the bad thing. I don't drink a lot of water, and my wife's on me all the time to drink more water.
Okay.
Because I'm somewhat dehydrated when I visit him every 6 months. So.
Oh, no. You're not somewhat dehydrated, my friend. As soon as I saw you, you are beyond dehydrated. You're dehydrated all the time. And understand something. If you had a plant in the house and you didn't like it, what would you do?
Throw it away.
No, you wouldn't water it, for one thing.
Pardon me?
You wouldn't water it because you'd forget about it, wouldn't you? Huh?
Yes.
So your wife cares more for you than you care for yourself. Because understand something. Guess what? At 70 years old, if you were drinking, 3 quarts minimum, 4 quarts is where you should be shooting. You should be having 2 quarts into you by 11 or 12 o'clock every day. 2 quarts into you by 4 o'clock. Now, you drink 1 quart a day. I can tell you right now, that's all you drink. 1 quart. And 1 quart is for a 60-pound human being. So your wife's right. You're dehydrated. Your bowel movements are dehydrated. That's why you have trouble getting them out. And so you have to absorb the water from your bowel movements because you don't have enough water coming into your body. So you're absorbing the water into your pelvis. Oh, wait a minute. That's right. Michael has herniated disc on 4 and 5. And if you were to go and check where your transverse colon is lying across your abdomen, right behind it is L4, L5. You will start having eventually kidney problems, peeing at night, and you will start having prostate problems. It's impossible not to because you're pooping in your pelvis. And believe it or not, because you're so dehydrated, the infection that you're absorbing from your large intestine is going down your leg because everything circulates. And the older we get, the less circulation we have, and gravity plays on it much more because, some of your friends, their feet swell. Some of your friends have neuropathy. Some of your friends have other problems. So many people have different symptoms, and your symptom is your knee. So, and the reality is that what has happened because of pooping in the pelvis, if we've got infection, we get inflammation, that's why your discs are bulging, because you don't have enough tone in your large intestine, otherwise the core, your abdomen, so your back has to do a lot of the work. Okay, so you're losing strength. And if you lose muscle tone in your large intestine, you lose 85% of your immune system. You lose 85% of your energy level. And eventually it'll be gone. And just like anybody that you see in their abdomen sticking out, like how many times do you eat and you feel more tired before the meal's even over? How many times do you eat and you feel like your tummy is getting bloated? All of those times, the food is rotting inside of you. And because you've been stagnating waste in there, you don't have good transit time. So that is a big problem too. Now I'm going to tell everyone, I'm getting questions here. I just want to say this. So if somebody was really wanting to change their life around, they go to my library. This isn't a sales pitch. You don't pay anything. Go to my library and watch How to Become Number One at the Art of Number Two. Go also watch, because it'll be the first time anybody's ever talked about the digestive tract like you should have learned, and go watch The Highway to Health. These are all master classes. And then go also and watch The Holy Grail, Your Large Intestine. And then tell me I don't know what I'm talking about. And if you make these changes, you'll change your whole life. So most people could actually fall asleep and then leave this world. But most people in the last 10 to 15 years are going to suffer like Michael. And Michael doesn't have to suffer. If he does what I ask him to do today, it'll be over. It'll be over. But he's going to have to take massive personal action, which means that when his wife is asking him to do something, he's going to do it because he knows that she loves him more than he loves himself. And that's the God's truth. If we were to love and care for ourselves, our body would not fall apart. And guess what? Michael, I'm going to get right into it, but I just want to say this. Maybe not you, but the majority of the population look at their body as a Visa card. They spend, and they don't make any deposits. So what happens is now he's having his Visa card recalled. Okay? And it's being recalled. And it will turn around as long as he's willing to go make the payments that he hasn't been making looking after himself. And it's not his fault. So let's not put any guilt here because it's not. Now I'm going to tell him what I would do. Okay, first of all, what I would do, Michael, is get yourself a structured water unit. You can take a look on my website. What kind of water do you drink?
Bottled water normally. In Arizona, our water is really bad, so I have what's called an RO system. So we drink water out of that, but most of the time we drink bottled water.
Okay, just so you know, reverse osmosis, there's no such water in nature. Reverse osmosis takes too much energy to digest. If you want to know the real science about water, structured water is the only water that we should be drinking because it's already been digested, which means that when it comes in, it has a frequency that when it comes near any cell, we have a what's called an aquaporin channel in every cell. And when it does, it matches up with the vibration of that. And it'll actually take structured water, and a water droplet has 2,500 layers to 3,000 layers in it. That's what makes a droplet. And guess what happens? As soon as that frequency lines up with the aquaporin channel of a cell, it stretches that 2,500 to 3,000 layer cell out. I think I'm going to sneeze, guys, in a second. Excuse me. And it stretches that. Thank you, sir. And it stretches that cell out, and it goes like a rocket. The water goes directly into your cells. Structured water will hydrate 1,000% more than any other water. Bottled water is a joke because that came from a tap and it went through a cheap filter, and that's just a whole marketing ploy that the world's running out of water, which it isn't. No water has ever left the planet. It's just another BS belief system. Whether you believe it or not, when you say you have bad water, does it come out clear?
Yes.
Well, guess what? You can actually take tap water and use a structured water unit. That's a structured water unit. Not trying to sell you, but this is all I do. I'm in Florida. I go right to the tap. I could show you right now. I fill up all my water jugs with a structured water unit. Water goes through here, comes out here. There's no filter. The reality is rainwater comes down, Michael, and guess what? It's full of heavy metals, chemicals, right? We know that. Well, why isn't it killing the birds, bees, flowers, trees, and all of the microorganisms? And I'll tell you why. Because it's structured. Because that, what we call creator, created that. In the ozone layer, it structures the water, so if there's anything toxic in it, it will not damage. That's why the crops are growing just as good as 500 years ago. And I go all over the world, and I use my structured water unit. We sell it right on our website. And we give you 90 days. If it doesn't blow your mind, send it back. You just pour anything through it. You can pour wine through this thing, and you'll get drunk quicker, but no hangover. No hangover. And that's what I'm trying to tell you. Structuring protects everything. It's called fourth phase water. And just know this, your bottled water's crap. Okay, so just know you're getting ripped off. And just know that reverse osmosis, if you want to do that, if you put it through the structured water unit, you bring life back to your water. And like I said, you've got 90 days. We don't even question you. I don't like it. I'm sending it back. So send it back. Okay. So that's the first thing. And if you did that, you would be able to, if you drank a glass of reverse osmosis, you can drink a whole quart of structured water because it has no surface tension. Did you get that? No surface tension. So it's pre-digested water, and people go, oh, that's a gimmick. Well, no, it's not. It's part of nature. So that's the first thing. And then if we were to get you to actually do 3 quarts to 4 quarts a day, that's going to change everything around. That's going to change so much around. I'm telling you right now. Now, as far as your knee goes, I would suggest that you get yourself a clapper and go on my website and go into the library and go into the do-it-yourself guide or go into the clapping guide, and I show how to clap your knee. But for now, what I want to do, let me see if I can show this. I don't think I can because it's so high. What I want you to do is, okay, let's say your knee's here, right? This is your knee. I want you to clap your knee like this. Now listen how hard I clap it. I don't think anybody can see it. Oh, here, look it. Yeah, we can see it. Let me see here. I can see it on that one. Let me move here for a second. Oh yeah, there we go. See? Can you see my knee? Now watch this, okay? Watch this. Now guess what? If you're the type of person that runs away from pain, we're in trouble. Now the reality is that pain is a GPS and you need to be the master of it. So even if you need to go in there light and just go like this, listen, that's nothing. You can't even feel it. And then gradually as the minutes go by, I want you to clap harder until it's like this. Listen, do that for 5 minutes the first week every day. Then do it for 10 minutes. Okay, every day after that. Okay, are you with me?
Hang on, 5 weeks every day.
No. First week, 5 minutes each day.
5 minutes, got it.
Okay, then after that, what I want you to do is I want you to do actually 10 minutes a day. And guess what? Guess who doesn't have patience?
I don't know.
You.
Oh.
Okay, so now you're going to have to learn patience. And you're going to have to put the timer on and do it. Now, when you go to clap your knee, it might swell up a little bit, okay?
Okay.
So I'm going to tell you what else to do. But just, what we're going to do is you can let the swelling come down if you want, give it a day. Or just go in the next day if it's swollen and then just stroke it like you love it. Did you hear me? I meant it. I meant this. Stroke it and then just lightly do this. Now, with your clapper, what I want you to do is I want you to get your wife to clap the back of your knee. You know where the lymph nodes are in the back of your knee?
Yes.
I want you to clap that for 3 minutes. See? And this is the smooth side. Don't use the bumpy side. Get her to clap that. Now, you ready for this?
Hang on. Just clap it for how long? I'm sorry.
For the back of your knee from 1 to 3 minutes and try to see if you can go to 3 minutes. And she'll clap about this hard. Watch. That sounds worse than it is, but now, let me just say something. When you clap, if you bruise, that means that you have issues in your tissues and you have decomposing tissues. Nobody bruises if they're healthy. Really unhealthy people will actually bruise without banging into anything. And you know that. People will say, oh, I bruised and I didn't even touch anything. Well, that's because they have decomposing tissue because guess what? They have issues in their tissues because they have so much infection on an emotional and physical level in their life. You terrorize yourself. You worry about money. You worry about the world. You get involved in all the BS going on. Then guess what? I don't get involved in nothing except to help people. People that want to take massive action, I'm there for. I'm not there for the complainers, the explainers. Tell me what you want. Don't tell me what you don't want. Tell me what you want and we will deliver it. Okay, that's it. What do you want in your life? What's your passion? What's your purpose? Where do you want to go? And let's go there. And then let's mind our business and enjoy our life because that's what it's about. Now, so I want you to do that. Now, I can't show you that.
Clapper, you said clap it 1 to 3 minutes. How many times a week or a day?
Well, you're going to clap it 1 to 3 minutes on the back. That's your wife. And she's doing that every day. You don't get a day off. You want to go golfing. So you want that knee better or not?
I do.
Well, just understand something, Michael. If you want something different, you better do something different. So you go and tell your friends this. They'll think you're crazy. But the reality is just keep it to yourself and get your wife supporting you. And we'll see where we are. I'm going to tell you something. If you were to actually do this in 3 to 6 weeks, you're golfing without pain. Now, is all of it healed? No. but we're going to get the pain down. That's the most important thing because the pain's driving you crazy. And then you'll get you off the drugs that are destroying the hydrochloric acid and disturbing your good bacteria in your large intestine, which is your immune system. How's that?
Perfect.
Okay, here we go. So now you're going to go, and this is where I get you. No, I'm kidding. So I need you to order DMSO gel and DMSO rose cream. Inexpensive. This will last you for a year or two. Doesn't go bad. I'll explain what it's for, okay? Then I need you to order Pain Away essential oil and Muscle Restore.
Pain Away central oil?
Pain Away essential oil. It's a pure essential oil, Pain Away. And Muscle Restore, okay?
So you've been using DSMO. I got that from the gal that did my massage, so.
Is it gel? Cream? What is it?
She has gel, but the one I got, the store here didn't have gel. They just had the liquid, so I've been using that.
It's not going to work. We need the gel. So if you want to order the gel, and I will tell you this, there's no DMSO gel like ours. And I'm not doing that to make you go and buy ours. Go do whatever you want to do. Okay, because the DMSO is really important, the purity of it and the consistency. What is DMSO? DMSO is... DMSO is made from pine trees. DMSO is the most powerful solvent on the planet. It's non-toxic. So I could put DMSO on my skin and then I could add Pain Away essential oil and it would take that Pain Away essential oil and it would take it right into my cells. But even the DMSO alone will go and increase the blood circulation, decrease the pain. So if we increase the circulation, that's like putting WD-40 onto the hinges, okay? And that's what, lubricating. So DMSO will also help to melt crystallization, get circulation going, to loosen up the calcium, to loosen up the beef jerky scar tissue that he's created in his knee from dehydration and from pooping in his pelvis, and that is the main reason. I'm going to give him a diet, which is a Live It, and I'm going to give him some supplements, and then he can do this. And then guess what? If he does this, we can have him back on in 3 weeks, okay? And if you don't, and if you see him not back on in 3 weeks, you know that he fell off and he couldn't do it. And you know, a lot of people can't do it because it's not built into their program, and because if not everybody's doing it, they don't want to do it. But the reality is this: we've been taught since we were born that guess what? When it breaks, we'll fix it. Well, that's BS. Okay, no doctor, no practitioner can fix you. They can help to treat you and reduce your pain and your suffering. But if you're not trained on how to look after and reverse the problem, it's not going to stay reversed. So that's the money grab. So whether you're a medical doctor or practitioner, if you are just treating and not training, that is not a good situation because everybody needs to become their own practitioner. Now, so I'm going to have you use the DMSO gel, okay? You don't need to use a lot. So start off with a little and then spread it around. And where I want you to spread it is where you feel the pain. I want you to also put a little bit on the back of your knee, on the sides of your knee joints, just a little bit. And then I want you to put it underneath your kneecap and then on the sides of your knee and then a little bit on top. Okay, now you can add the Pain Away essential oil when you're in pain. When you're not in pain, I'd rather you added the Muscle Restore because that's going to go in more to heal the tissues. But the Pain Away essential oil is going to bring the pain down. And how often? Well, first of all, wear shorts because I want you to actually put the DMSO on about 6 times a day. Don't put a ton on. And then I want you to apply the Pain Away essential oil every hour. Did you get that?
Yep. Every hour.
Oh my God, that's going to cost me so much, Dr. Wolf. No, you're just using a few drops and that's all you're doing. And understand something. I need you to get this, Michael. Especially our generation. Take a pill, have a thrill. The pain is gone. The more that you decide to take massive action in loving and caring for yourself, Michael, okay, the better you're going to do. And that's it. Okay? So if you need a schedule, you put the schedule down and you make sure you follow it. You follow it with your heart if you want to go golfing. If you want to go golfing until you leave this planet, you can do it if you listen to what I say.
Okay.
Okay, and I mean that.
And the muscle restore, does that go on afterwards, after the pain essential oil?
Yes, it does. But the thing is that the more calcification, more scar tissue formation, the less feeling you're going to have. Now, when the feeling comes back into the knee and starts to come back, or if there's too much inflammation in, you may only be able to put the DMSO gel on. And then if you added the essential oil, it might be too much energy. So you decide, just know you're not going to hurt yourself. Next thing, okay, are you ready?
Yep.
I need you to apply this when you do the DMSO. I need you to get what's called, and you can get it's called MCT 60 Beyond Beauty if you want to get a smaller jar, a pump. Like, you can take it eternally, but I'm not here to try to put you on a full regime. So what I want you to do is I want you to take a little squirt, a few drops, and after you put the DMSO and essential oils in, every time you do that, you're just going to take a few drops and massage your whole knee with MCT C60 oil, 250 times stronger than vitamin C as an antioxidant. And it's going to go in and it's going to help to heal and also make sure that your skin doesn't get red or dried out because of the DMSO. Are you with me?
Yes.
Okay, all right. Okay, now, the other thing that you should be doing is doing daily cleansing tea, because we need your bowels to move. And if you want to do yourself a favor, I'm only going to give you very few products so that people can see that I know what I'm talking about. So we're going to give you daily cleansing tea in black gold. Now, daily cleansing tea, take it like it says and make it like it says. But what you're going to do is you're going to start off with 4 ounces of daily cleansing tea morning and night. And if you were an intelligent person and you do your homework, and you find out that I'm not lying about how you've been pooping in your pelvis, know that you're 70 years old. You got 70-year-old plumbing that's never been looked after. Take the daily cleansing tea, 4 ounces in the morning and night. And then after about 4 days, you might go to 6 ounces or 8 ounces twice a day. It's inexpensive, trust me. 1 tea bag makes a whole gallon, okay? So the reality is the tea is going to go in and start cleansing out your liver, your kidneys, your large intestine, your blood, your lungs, all of the detox organs, your lymph system, which you are backed up. Now, how bad? I don't know. I'd have to go and do a whole consultation with you. But, so the daily cleansing tea twice, and do you promise me that you'll do a strawberry or a blueberry organic berry drink with oat milk or coconut milk, and you're going to put in 1 raw free-range organic egg, and you're going to do a blender drink twice a day, and you're going to put in a rounded teaspoon of black gold, which will go in and help to bring your bacteria back to life and it's going to go in and start sucking up the heavy metals, the parasites, and the fungus, okay, that are in your digestive tract and bowel. Usually I will go a lot further, but you called just for a knee problem. You're already going, I'm already overwhelmed. Stop it. So, yeah, but you can go back and watch this on Facebook. Now, the next thing is that I want you to take what's called Curcumin Cayenne 5000. Why do I want you to do it? Well, it's inexpensive. Get yourself a large jar. And I want you to take 1 every hour to 1 every 2 hours, as much as you're awake. It's very inexpensive. Trust me. Curcumin Cayenne, okay, some people say, oh, I take turmeric. Well, curcumin is 20 times stronger than turmeric. And when you add African cayenne to it, just 6%, it brings it up 50 times stronger, and it will clear out and it'll clean up your circulation and it'll make things much better. There it is. I'm not going to give you any more. Now, I need you to tell me that what do you do when you get up in the morning? What's the first thing you do?
Go to the bathroom.
Okay, that's good. Then what?
And I take my thyroid pill.
Why do you take a thyroid pill?
As I don't have a thyroid any longer. I had a hyperthyroid years and years ago, and they.
Well, okay, first of all, we already know there's no such thing as a hyperthyroid. We know that that's a person that had so much anxiety, they blew themselves up. So you're going to say, I don't believe you, Daryl. Well, that's fine. You don't have to, and neither does anybody else, because I don't really care about whether I'm believed or not, but I'm telling you the truth. And guess what? If you don't take infinite iodine, my friend, you're in trouble. Just because you don't have a thyroid, you still need iodine every day. So I want you to get the infinite iodine I have. It's on sale right now. And I would highly suggest that you and your wife, okay, take 10 sprays a day. That's it, each. And tell me that you don't feel better.
Infinite iodine.
Yeah. See, in my experience, I have to be ready for most people not to believe hardly anything or only some things I say. Because unless everybody's talking about it, it's definitely a lie. Okay. Now, just know this. Nobody can live without iodine. And if you don't live on the ocean, and if you're not eating fish every day, which I wouldn't suggest because it's pretty toxic lately, but get on the infinite iodine and see if I'm right or wrong. You can call me, Michael. You've got my phone number, so, you can terrorize the hell out of me if you'd like. So now, next thing is, okay, so you get up in the morning, and the first thing I need you to do is I need you to drink 1 quart of warm water. Structured if you don't mind, and if you don't, well then okay, do whatever you want to. But 1 quart of warm water and squeeze half a lemon into it, and then I need you to drink that before you do anything else. Now, what do you do after you go to the bathroom, my friend?
What do I do?
Yeah, what do you do?
I drink my coffee.
Well, you're not drinking your coffee until you have that quart of warm to hot water with lemon, okay? We lost you. There you are.
Yeah, my wife's trying to call, so that's all right. No problem.
You sure?
Yeah.
Okay. If she calls back, if you know, you can put me on hold and then talk to her. She should come before me. I'm okay with that. Okay. So just know that. Anyways, no. And your coffee, tell me how you make it.
You mean what I put in it?
Yeah.
Creamer. Probably too much creamer, but I like it sweet.
Well, wait now. You put in a sweet creamer?
Yes, French vanilla.
Okay, well, that's totally toxic. So what I want you to do, can you do this? Can you go and buy some real vanilla? And then just put 1 drop to 2 drops and stir it in. And go get yourself coconut, okay, cream. And make sure it's only coconut cream. And if you go, why don't you read the ingredients on your creamer, your vanilla creamer, and you're going to find out that it's got cancer-causing chemicals in it, just for fun, okay? And then don't ask yourself why you're on fire, all right?
Okay.
Okay, I want you to be a highly intelligent person in the way that you are going to read your ingredients. Now, hold on 1 second here. Let me think. I'm trying to remember what the app's called. Give me 1 second. I'm going to be right back. Don't go anywhere.
Okay.
I want to give you this. All right, I'm on my way back. This is worth it. YUKA. It's an app. Download it on your phone. And then guess what? I don't want you to buy anything unless you are going to use that app. YUKA. Okay?
Got that.
And
YUKA.
yeah, why don't you find out how you're poisoning yourself with that product? And if you're drinking that, just think of all the other stuff that you're doing that's not good for you.
Right.
All right? Understand something, and you need to get this. The tobacco industry owns all the food corporations in the United States right now. Did you know that?
Nope.
That's who's feeding you. Okay? They're the same guys that told us that we should suck really hard on our cigarettes to exercise our lungs. Okay?
Okay.
All right. Okay. All right. So, I want you to also, if you're going to buy the black gold and put that into a blender drink twice a day, and you don't have to do the raw egg, but if you do a raw organic free range egg in your blender drinks, that will curb your appetite because you don't eat that good. Okay?
Okay.
All right. And I'm not downing on you either. So after you did your coffee, what are you going to do now?
I get ready and I go to work. I work part-time even though I'm retired. So
What do you do?
I manage a storage facility. So I answer the phone, do a lot of the maintenance, painting, clean restrooms, trim bushes, that kind of
Okay.
thing.
All right. Now you're going to go out today and you're going to buy yourself a 1.5 quart stainless steel bottle, and you're going to fill that sucker 3 times while you're at work, and you're going to drink it. And then you're not going to complain about having to go to the bathroom all the time for about 6 weeks to 3 months because you don't drink, and your bladder has actually shriveled up like an old sack. Okay? And I'm telling you the truth. So I need you to take your bladder to the gym.
You said a 1 quart stainless bottle?
Oh, I said 1.5 quart because guess what? I know you. Oh, I just got so busy. I couldn't refill it, so I couldn't drink it. So now if I do 1.5 quart and you fill that 3 times a day, that's 4.5 quarts. Guess what? We're going to change your life. And if you get a structure water unit, guess what? You'll never look back. And if you want to return it in 90 days, go right ahead. Okay? But the reality is you want to pour everything you drink through a structure unit, and you clean it really easy just with white vinegar, or putting it in your dishwasher on the second rack. I'm not trying to drain you of your money, so just know that. And if you're in California, do you shower? Do you have a shower filter?
No, I'm in Arizona, but no, I don't.
Okay, well, guess what? If you want, you could buy a shower filter. Structured shower filter, and guess what? You'll call me up and go, oh my God, the water is so beautiful, and there's no filter, it's just structured, and guess what? You'll never be damaged by the chlorine, the fluoride, and guess what? You're so worried about drinking the tap water. Guess what? Do you shower every day?
Not always.
But do you want to know something? You've taken in 10 to 20 glasses worth of chlorine and fluoride, okay, when you've done 1 shower. That's what your skin has done. That's what you've done to your skin. So if you buy that and then fill up your jugs with your shower unit if you don't want to spend any more money. Okay? Now you've got both things covered. Okay? All right?
Okay.
Okay. All right. So now after you do that quart of warm water with half a squeezed lemon, then you can have your coffee. And understand something. You'll enjoy your coffee more because how many cups of coffee do you have a day?
Usually just 1.
Okay, let's go on. So what do you do after the coffee?
Like I said, I get ready and I go to work.
You don't eat? You don't do anything?
I'll have a fiber bar sometime. Oh, I'm sorry. Well, the other thing I started doing, because my wife does wellness coaching on the side, so she has me drinking these, who makes it? Herbalife protein shakes.
Oh, no. Please don't. Please don't. Please don't. Just do the berry drink with the raw organic egg. Herbalife. Okay, so is it whey protein? Please look at it.
I don't know. I have to go over.
If it's whey protein or it's pea protein, it's constipating. And you don't need any more of that. Okay?
But should...
And Herbalife is not the worst, but it's definitely not the best, okay? Multi-level marketing, they need to cheapen their products, but try to give you the best they can because too many people need a payout. And I'm not trying to down it, okay? So I'm not downing it, okay? But I'm just telling you right now that you want a sprouted organic protein, not pea protein, not whey protein, not soy protein, none of it, none of that. And it's way too much. You don't digest it. You don't break it down. And God love your wife for doing this, but don't do it.
Okay.
Okay. Now, but guess what? Do you know what would happen? So what did you mix the protein with when you did it?
Ice and water. And I usually put like a half of an orange and a part of a banana in it.
Okay, so what I'd like you to do is I'd like you to take strawberries, and you can put a half a banana in it. Then I'd like you to take oat milk or coconut milk and make sure they're the cleanest possible. And then what I'd like you to do is put in a raw egg, or even two of them. You're not going to taste the egg. It's just going to thicken it up. And then people, you know what people do here? You're going to love this one. Yeah, but what about salmonella? Well, you don't even know anybody got salmonella from a raw egg. You'd have to take a raw egg drink and let it sit in the hot sun, okay, for like a couple of hours and then drink it. Who does that? So it's like anything else, you know. But the reality is, if you do the raw egg, okay, instead of cooking it, you're going to absorb almost 70% or more of the amino protein, whereas if you cook it, it's only 17 to 23%. Okay. All right. Okay. Now, if you can get your hands on raw, real cream, cow's cream, do that if you want. If you want to mix that with your, but it's got to be raw, not pasteurized. Okay. And if you want to do it, and if you can't get it, then look for the coconut creamer, and look for one that's doesn't have a bunch of gums in it. Remember something, YUKA, Yucca, download the app and find out how they're trying to poison you, and understand something. Even if you buy something that was organic last week, tobacco industry will buy it up and then poison it. And then you've always got to look at the label when you buy things, even from a health food store, doesn't matter. Okay. It's just one big crazy game down here called a life-threatening, fun-filled adventure. Okay. So now you went to work. What are you going to do? Tell me what you're going to do now.
At work?
Yeah. Like, what are you going to do for lunch?
Realistically, I don't usually eat much lunch.
Okay. So
I'll come home and maybe have a piece of fruit, like an apple or.
Okay. Okay. I'm telling you that you're malnourished. Okay. You're really malnourished. You don't put a lot into you. You work hard, but you don't put much into you. Okay? Now, I need you to do this. Why don't you make up a blender drink, like I just asked, and make up a blender drink that's 1 quart with 2 raw eggs. 1 quart of a whole blender drink. And then drink that on the way to work, and drink it when you're at work. And guess what? Quit starving yourself. Okay, now, remember, you still got to do, if you do 1 quart of a blender drink for me, you still got about 3 quarts to 3.5 quarts of water to do during the day too. Do you understand? But let's do 1 quart of blender drink and take that with a raw egg or even 2 in it. And I'm going to tell you, you're going to call me up and you're going to go, I never felt so solid. I didn't realize that I wasn't thinking well. When I wasn't doing this, I wasn't grounded. I mean, the pain has even left. Oh, yeah. Okay? Remember something. It's not how much you eat. It's what you eat that turns off your hunger. Because your hunger is actually based on enzymes and minerals, okay, and antioxidants and things of that nature. So let's bring in high vibrational food and turn this body on, okay? The best fruits to put in a shake, everybody, are berries. That's right. And guess what? Blackberries, currants, pomegranate, if you wanted to put some in there. But blueberries, strawberries, berries are the key. They're the key. They're the richest, okay? And don't be putting a ton of different berries in. Try to only go with 1 berry, or if you wanted to, you could put like... you could crack a pomegranate. You could put the pomegranate seeds and everything in there with like the blueberries or the strawberries. But don't do any more than that. People always make their life into a buffet. And then, you know, it's like this. Can I do 1 thing in a room better, or can I do 3 things in a room at the same time? You can't. Just be easy on your digestive tract. Okay, I never overload my digestive tract. If you want to eat like a buffet, you're going to be as big as a buffet. That's how that goes. Okay, all right. Okay, all right. So anyways, you might come home. Well, guess what? If you don't come home, at least you did the blender drink. And if you want to come home and see that beautiful wife of yours, you'll grab a piece of fruit, but you'll be in a hurry to get back probably, right?
No, I only work 3 hours in the morning. I'm off the rest of the day.
Okay, so what are you going to do the rest of the day?
Usually do stuff around the house, around the neighborhood.
Okay, good. I want you to do this for me twice a day, okay? And I want you to come on in 3 weeks. That's the deal. Because if I brought you on today, I want you to come back on in 3 weeks. Where are you going? Okay, honey. Listen to me. That's the deal. And when you come on, you're not allowed to lie, okay? Oh, I never lie. Okay, that's great. Okay, so here's the deal. I need you to do my pelvic squats. Go to my do-it-yourself guide and go in and watch the video. Okay, you'll see I'm like by a pool, and you can incorporate the other things, but I need the 3 pelvic squats done in the morning, and I want you to hold them for 1 minute to 5 minutes each. You need to get to 5 minutes, and then you know you're not going to the nursing home. Okay, so the pelvic squats, the 3 of them.
Is this all on your website, by the way, or is it on...
You're going to go to my library. Go to docofdetoxlibrary.com. Okay, or just go to Doc of Detox, click on library, go into the library, do the 3 pelvic squats. Now listen to me. You're not going to be able to do them. You're only going to be able to crouch down a little bit. So if you have to hold the table or hold the dresser, you do it. But I need you to breathe, and I need you to, when you feel a little bit of pain, I need you to breathe into that pain. Do not contract. Breathe into it. And picture yourself breathing that oxygen, that energy down to where the lock is, the block is. Okay? And I want you to do 1 minute. I do this every day. In the morning, I hold them for 5 minutes each. While I'm doing that, I do my meditation prayer. Go take a look. And then I do the crab stretch. And then I need you to do the crab stretch. If you do the crab stretch and you do the pelvic squats and you do them in the morning and at night, and you do that for 3 months, you will have the agility that you had when you were 30 years old, just by those 4 things. Do you get that?
Yes.
Okay. All right. Now, if you want to spend a little bit more money, get yourself what's called a belly button therapy kit. And this is where you actually are going to do a routine where you're actually pumping your belly button. You can go look at that at my do-it-yourself guide in the library. And if you do that, you'll have 25% more stretch, because when you actually do the belly button therapy routine, it will release serotonin, dopamine, oxytocin, serotonin, endorphins more than anything else you can do just by playing with your belly button. Okay, but you're going to have to get that lint out of there first, okay?
Wait. Oh, yeah.
Okay, but just take a look at this. And like I said, you can go to Facebook if you want to rewatch this, or you can go to Braveheart Nation on Telegram, and that'll be on there tomorrow. So if you have Telegram, you can go on there. Okay, and I know I'm on TikTok right now. I'm on Instagram, but I don't know how to look at those. Okay, and this goes up into YouTube as well in a day. Okay.
Braveheart Nation an app?
Braveheart Nation is just like a name of a platform. Do you know what Telegram is?
No.
Okay. Well, go look. If you download Telegram, which is a very private app, download Telegram. And if you download Telegram, you can always go on Braveheart Nation, and you'll see all my shows. They all go up there for people who don't know or don't want to go on Facebook, okay, or TikTok or Instagram or YouTube.
So I can go on there and pick up anything I didn't catch.
Absolutely. Now, if you do those exercises, I'm telling you, if you did those exercises with all your heart, and don't push yourself that you feel you're going to tear out, because you're beef jerky. Remember, we decided that, right?
Yes, I know.
So just know that if I get hungry, I'm not going to try to eat you. You'll be way too hard. Okay? All right? But that's what happens to everybody. You need to get this. There is no old age. Old age is when your joints are creaking because of the calcification and the scar tissue formation that won't allow you to extend or flex, and you're losing your power because of all the blocks you have in your body, from your bowel to your liver to your joints to your organs to your brain. Most people are blocked up here, and they stay blocked there because everybody's been programmed. Because you got to understand something. School was nothing but to program everyone. You know it as well as I do. When you're done grade 12, you didn't learn anything. you thought, oh my God, I just spent 12 years of nothingness. And yeah, we all felt the same way. Okay. Any questions?
Not so far. I'm going to, like I said, I've got all this stuff here to read back through, and I'm going to go back on in case I've missed some stuff and add it in here. So.
Okay. So, are we going to sign a contract and you're going to come back on?
Sure.
Okay. So, let's say 3 to 4 weeks, give me a call whoa. But if you have a question while you're doing this, just call me. Okay. And never feel like you're interrupting me. All right. It's all about follow through, right?
All right. Any certain time of day to call?
Well, I'm going to be here for another 3 weeks. Then I go to Puerto Rico and I'll be there for 2 weeks. And then I go to Mexico. So the thing is I'll always call you back. I will call you back. Okay.
Leave a message, don't answer, right?
Yeah. I'm just going to put Michael beef jerky. And then when it comes in, I'll know. I'm kidding. Just know this. You can't do better until you
Savage.
I know. Michael Savage. You're savage. Everybody, you can't.
Host either. So.
What?
I'm not the radio talk show host.
No, but guess what? You can't do better till you know better. And it's nobody's fault that they're not well. But understand something. If they give me a chance, they can go into my library. It's completely free. Just go dive into the library with your wife, okay?
Okay.
And I wasn't trying to put down her protein powder, but they're not great. They're not great. Just know that, okay? Watch out for that. Very constipating. All right? People don't get it. Now the big thing is pea protein, right? Okay? To find a really good protein, you gotta know what you're looking for. Look for a really sprouted protein, very clean. Okay? All right?
Okay.
All right. Any other questions?
Not now, I don't think. I think I'm kind of overwhelmed, but I'm going to figure it all out. So.
Well, guess what? You're worth it, right?
Yes, sir.
You're worth it. Okay. Well, thank you and have a beautiful day, my friend.
Thank you very much for your time. I appreciate you.
Be well.
Good day. You.
Bye.
Bye.
Well, there you go, everyone. So just know this: I will be doing real people, real healing, and today this is my second one. Earlier I did one, and it was with a gentleman. You can go back on Facebook or go take a look at one of the other platforms, and he had skin cancer. It was about as big as a nickel, and that was in July. And the skin cancer is completely gone. And I actually asked him to clap his skin cancer every day for 5 minutes. Okay. And the reality is he spent very little money. He changed his diet, some things. I got him to do things like DMSO, Frankincense. Okay. And do the clapping. And we did some diet things. But he went to his doctor and he was just there. I think it was October. What did he say? I can't remember. So I might be wrong. But he went October 5th, I think it was. And his doctor said, I don't know where the cancer is. Where it's not even here. Where was it? So the reality is this. Your body's beautiful. You're beautiful. Okay? And you were created by God Almighty. So let's start acting like it. Okay? So here we go. I am love. I am healed. I am Braveheart. 3, 2, 1. Together we have this Braveheart Nation. Have a beautiful day, everyone.